It was a long journey to go from mathematics really to medicine, but it was sort of step by step. I worked my way through college doing computer programming, and I worked for a lot of the aerospace companies. So I ended up doing things like helping to design spy satellites and that sort of work, which was interesting and theoretically very challenging. But I guess I felt, I was blessed with a talent to actually be able to do mathematics and think about things. And I really, I really felt an obligation to do things that affected the population and to help humanity, not simply do defense work. An area where I've spent a lot of my time is in breast cancer, where we know the women are at high risk because of strong family history and so forth. And from clinical trials, it's pretty clear that estrogen is a strong factor that causes breast cancer. We looked at the trials that reduced estrogen in women with breast cancer as a treatment and looked at new cancers in the opposite breast, and they were being reduced by about half as well. So that gave us the hint that this is probably a good preventive therapy. We've since done big trials to show that that's true. We're beginning to find drugs that will actually prevent cancer, just like the cardiologist discovered decades ago that it's better to prevent heart attacks than to try to treat them. You went to your doctor and he says, your blood pressure is high, come back in a year and we'll see if you've had a heart attack. You wouldn't be too pleased. I mean, they identify these risk factors and treat them. And we've got to get that message out into cancer. And there's a lot of fatalism. People just don't believe that there are things you can do to prevent the cancer. And we're actually beginning to realize that there's more things that you can do to prevent cancer than people realize. One of the most exciting new areas is for the use of aspirin in prevention, where trials that we're looking at low-dose aspirin for cardiovascular benefits with long-term follow-up have shown big reductions in colorectal, stomach, and esophageal cancer. And so we're very excited about offering that much more widely to the general population. One of the biggest challenges with clinical trials in prevention is that they need to be large and you need long follow-up. And the regulations for running clinical trials have become really unnecessarily onerous for quite safe drugs that have been used. But it pushes the cost up maybe 5 times higher than they should be. So just getting the funding to do the big trial is our biggest challenge. We have a number of new ideas, but getting the funding to do a definitive trial is very, very challenging. People think of cancer as one disease. It's clearly a range of different diseases. So it's going to be much harder than heart disease because it's not just a simple disease, but there are many causes, many types of cancer, all of which need different approaches. My work has been very much in prevention, where we're very excited about the fact that we might be able to prevent up to 10% of cancers just with something as simple as the low-dose aspirin. In terms of treatment, the great excitement is that we're beginning now to identify the genetic mutations that have caused the cancer. So by taking the tumor tissue out and looking at it, you can look to see what the cancer has done to those cells genetically to change them so they grow like cancers. And then different types of mutations are associated with different effective treatments. So you'll be treating cancer soon, not depending on where the site was, but what type of mutation caused that cancer. And that's likely to be, I think, a big step forward. Mathematics is the language of certainly science and maybe thinking in general. And one of the great things about a mathematics education is it teaches you logic and how to think and how to put things together. I think that's a really fantastic skill, especially if after you've learned that, you don't simply stay in mathematics and do theoretical things, but actually try to apply that to the new problems of the world as they come along.